The reason we're here today is to talk about being an MVP. The chapter leadership of this association has asked me to come in and help you take better care of yourselves so that you can take better care of other people. Because your most valuable patient is you. You need to take care of yourself. You need to improve your fitness and your wellness and your health status so that you have the energy, so that you have the ability to provide the care, especially you folks that, again, are the ones furthering their excellence and have that commitment to excellence. Because if you get sick, if you're not able to perform your duties, who will? So we want to make sure that you look at yourself as the most valuable patient. And it's a problem sometimes because caregivers tend to be very heroic, especially nurses, I think, and especially female nurses. They tend to put their family, their patients, everybody else first. And while that sounds very noble, the problem with that is, again, if you get sick, you can't do it. There's nothing selfish about taking care of yourself, especially if you're somebody whose other people are counting on. And so keep that in mind, because to be a nurse and to be a caregiver, you have to be healthy to do it right. I mean, to be a good caregiver, you have to have a sharp mind, you have to have quick feet, you have to have a strong back, you have to have a big bladder. So I mean, and the emotional and psychological toll that it can take on you sometimes, you need to worry, or not be worried about those things, but be aware of those things. And make sure you do your best to take care of you so that you can continue to take care of other people. And the reason is because the people are counting on you. And again, it's not selfish, it's what I call sustaining. Your patients are counting on you. Your organization is counting on you. Your coworkers are counting on you. The community is counting on you. And your family is counting on you to take care of yourself so that you don't end up being like some of the people that you're taking care of. And you see the toll that can take on a family, the strain it causes not only on the patient, but on their family, their extended family even. So we want to, again, take care of ourselves. It's not a problem. Because, and again, you are an example. You are a teacher. And if you take care of yourself, you're going to be so much better able to get that message across. I mean, when we were talking about diets, I mean, when you tell patients that they can't eat a certain type of food, it's going to mean a lot more if you don't smell like McDonald's. I mean, that McDonald's has a smell that permeates, doesn't it? I mean, you could go to McDonald's and 2 days from now somebody will say, did you go to McDonald's? So you have to keep that in mind. If you have pizza stains on your scrubs or something like that, I mean, it's going to mean so much more if you practice what you preach. Now, you don't have to be a fanatic. In fact, one of my presentations, my signature presentation, is called Fitness for the Rest of Us, because I'm not a fanatic. You have to be happy, and I talk about what I call thresholds. And it's kind of the idea of, again, excellence. Not being perfect, but just doing the best that you can right now. But at the same time, not being content with that right now. And hopefully next week, you're a little bit better than this week. And next month, and next year, and 5 years from now, you're getting better and better and better, and trying new things, eliminating old habits, bad habits, and introducing new practices into your life.